Let's continue with assessing. In the previous videos, we were reviewing how to assess patients and their families. Remember, I said that assessing aims to understand the patient's situation as a whole. Assessing involves the 5 A's. We already reviewed being attentive, eliciting patient's agenda, and using your active listening skills. Now let's talk about asking open-ended questions. As you may know, open-ended questions start with the words what, when, where, who, and how. These types of questions are the best to assess patients' illnesses and their perceptions.
Robbie, what is your favorite food?
Pizza and ice cream.
Those are my favorite too. When you eat, where does it hurt?
Open-ended questions elicit narratives and encourages conversations and connections. Avoid questions starting with why. Why you like pizza? Why did you eat that? Why are you here today? These type of questions sound like a disapproval.
Robbie, what did you eat today?
French fries and chocolate cake.
No wonder his stomach hurts. Mom, why are you letting your child eat junk food?
He is such a difficult eater.
Really, what type of excuse is that?
When assessing, avoid judgments. This is known as unconditional positive regard, which is the ability to accept another person's beliefs and behaviors despite your own personal feelings. Unconditional positive regard is not always easy. It is a difficult mindset to achieve. Each patient and family brings a lifetime of response, beliefs and values that may be very different to ours. Each patient and family requires respect and acceptance. When we judge, we become less curious.
Robbie, what did you eat today?
French fries and chocolate cake.
I see. Mrs. Perez, what type of food does Robbie eat mostly?
He is such a difficult eater.
Please tell me more. How is he a difficult eater?
No judgment and acceptance does not mean approval or agreement. It means a non-judgmental attitude to make patients and their families feel comfortable explaining their perceptions of things. The role of silence is significant. After asking a question, allowing silence helps the patients and their families think about their answer.
What type of behavior modification strategies have you used to improve his eating habits?
However, silence may indicate the patient has not understood your question. The silence should be long enough to provide a thinking moment but not so long to make the patient uncomfortable. Also, please use non-clinical language when asking questions. The final A in assessing is to express appreciation to our patients and families by saying thank you to them. Saying thank you is a small gesture with a large impact. Gratitude has impacts for both the giver and the receiver.
Blah blah blah. Blah blah.
Mrs. Perez, thank you for that information. I will make sure the doctor knows this issue. Robbie, thank you for telling me about your favorite foods.
Good job. Research shows that using these active listening techniques will change nurse-patient communication positively by identifying concerns, needs, stress, fears and feelings. It will also impact on patients' safety, since one of the important causes of medical errors is ineffective communication. I challenge you to be more self-aware about how you assess patients and their families. How are your active listening skills? Are you able to have unconditional positive regard for all your patients? Please think about it. Next we will talk about assessing suffering, needs, concerns and feelings.